My name is Dr. John Johnson. I am a board certified physician for more than 25 years and previous board chair of the Medical Association of Atlanta following my presidency in 2024. I also serve as first vice president of the Medical Association of Georgia. I currently serve as chief medical officer for the Government Employees Health Association, or GEHA, and we're a nonprofit member association providing medical and dental benefits to millions of federal employees, military retirees, and their families. Prior to going into managed care, I had the opportunity to own my own internal medicine private practice for over 20 years in the Atlanta metro area, where I served and treated patients with acute and chronic illness. I am a proud Colonel and Battalion Commander in the United States Army Reserve's Medical Corps with 28 years of service. Today, I am joined by my friend and colleague at the Medical Association of Atlanta, Dr. Randy Rizor. Together, we're discussing military medicine, a field that has profoundly shaped both of our lives. Today, we will speak about our motivations for joining the military, our experiences serving, and about how we did this while balancing our career demands as physicians. We hope this webinar will inspire early, mid, and late career physicians to be open to exploring new opportunities as you continue your journey. And we hope that our experiences help our viewers reflect on the importance of Veterans Day. Dr. Rizor, thank you for being here with me today. Dr. Rizor and I have known each other for over 20 years and have had a lot of strong history together. Can you please introduce yourself to our viewers and share a bit about your background?
With pleasure. I'm Randy Rizor. I'm the president and medical director of the Physician Spine and Rehabilitation Specialists of Georgia. I'm a board certified anesthesiologist, and I've have over 40 years of experience as a pain management specialist, helping patients with acute and chronic pain, and specializing in musculoskeletal pain and care of workplace injuries. Like Dr. Johnson, I'm a past president of the Medical Association of Atlanta, and I'm an ex officio member of its board of directors. I also serve on the Chairman's Advisory Council of the Georgia State Board of Workers' Compensation and advise its chairman on medical matters. I'm the founder of the Rizor Institute, which is Georgia's first and actually only residential program designed to address chronic pain and reduce opioid dependency using a comprehensive interdisciplinary rehabilitation approach. Most relevant to this webinar, I retired from the Army Reserve Medical Corps in December of 2024 at the rank of colonel after 22 years of active service. And I'm extremely pleased to be here with you, Dr. Johnson, for this Veterans Day conversation.
Thank you, Dr. Rizor, and thank you for your service. So let's look back at how and why we started our journeys into the military and talk a bit more about the paths that as we look ahead and started our careers. For me, duty, honor, and selfless service have always shaped my life. They've been important values for me, and it resonates with my military service and mission. It's an extension of who I am and what I do, both as a physician and as an individual. My entry into the military was as a direct commission, straight out of medical school. I began as a combat physician, deploying around the world in support of both combat and humanitarian missions as an internal medicine specialist. I can recall my very first deployment was to Womack Army Medical Center, supporting the 82nd Airborne at Fort Bragg in Fayetteville, North Carolina. It was somewhat scary because it was my first time leaving my family. My inspiration for joining the military came from my family, actually. My dad and my paternal uncle both served in the Marines during the Vietnam War before I was born. And I also had an older cousin who served in the U.S. Army active duty when I was in high school. Whenever I would see him in his uniform, it was both inspiring and somewhat intimidating to me as a kid. Now I'll turn it to you, Dr. Rizor. I think it's important for our viewers to understand that we both embarked on our paths very differently and our careers and help us understand the distinct motivations that led you here.
Sure. Um, I think looking back that there's three reasons why professional people join the military. First, there's people like you. They join because they're carrying out a family tradition of leadership, service, and patriotism. Then there's a set of people that join because they realize that the military affords unique opportunities for education and leadership and building physical and mental resilience that they simply can't get anyplace else. And then there's a third group. They don't really have a reason. They join on impulse, and that's me. Um, I In 2001, I was 48 years old. I had a successful career. I had a beautiful home, a beautiful wife, two kids in private school. And on 9/11, 2001, I was in New Hampshire on a college tour with my son. And we were in a small commuter plane that morning, and we're out. Basically, the engines were running. We're ready to take off, and a guy comes running out from the terminal and gives the signal, and the engine shut down. And we walked back inside and saw on the monitor what was going on in New York. We stayed in New Hampshire for 4 or 5 days waiting for the airspace to reopen, and obviously watching that scene play out again and again and again on cable TV. And finally, after about 4 days, I rented a car and decided to drive all the way back to Atlanta. And the trip took me down Interstate 95, which, as you know, runs along the Atlantic coast. And when I got to New York City, I could look across the Hudson River and see the smoke that was still rising where the World Trade Center used to be. And then we got to Washington, D.C., and we deliberately got off the interstate and drove through D.C., and we could see the smoking ruins of where the Pentagon had been damaged. We saw people in the street, they're all holding candles, and we realized that, nothing like this had happened to our country before. So I had a lot of time to think. And the first thing that came to mind was what it meant to be an American, and the fact that I had achieved everything I ever dreamed of. Everything I dreamed of as a kid, I'd already accomplished, and I had. And not because I was so smart or so talented, but because I had the opportunity, just because I was born and raised in this country. And I knew that, just seeing what I could see of what had happened, that the United States was going to respond to that particular insult, and that young people were going to get called up to serve and make tremendous sacrifices. And a lot of those people being called up would not yet have even realized half of what I'd had to realize as an American. So I got home, got out of the car, got things squared away, sat down to dinner, and my wife and I talked about it. The next day, I called the recruiter. Now, it's not like it is in the movies. You don't walk into the recruiting station the next day you're on the train, headed for basic training. It took about a year to get all the necessary documentation and the physical examination, and check every boxes. But about a year later, I raised my right hand and joined the United States Army Medical Corps.
Thank you, Randy, for sharing that. All of us can recall where we were and what was going on in the world during 9/11. And so I'm really inspired and moved by your motivation to join the military. Let's talk a little bit more about what your service involvement meant. Your service was more focused on patient care, correct? So can you talk a little bit more about your role as a physician with regards to patient care in the military?
Yeah, my main reason for joining was to take care of the sons and daughters of Americans who were going to be put in harm's way. And a lot of that I thought about, what it would mean to me if my children were over there serving, and I wanted to be the person that could provide that expertise. So the first half of my military career, really the first 10 years, was basically directed at patient care. And my first assignment was chief of anesthesiology at a United States Army hospital in Kosovo in 2004. And there I was able to care for the soldiers on the base. We did routine surgeries for not only the military, but the civilian contractors, and also took care of some of the people in the surrounding villages. That was a stabilization force that supported the United Nations missions there, so we weren't seeing direct combat casualties. But my next deployment was a little different. In 2007, 2008, I was chief of anesthesia at the 325th Combat Support Hospital in Tikrit, Iraq. And this was, as you remember, the Iraq War. That was right in the middle of what we called the surge, where we had a marked increase in military activity. My mission there involved basically giving anesthesia for combat surgery and directing anesthesia and critical care within the hospital. And we were the first point of surgical care, definitive surgical care, available to any service member who was injured in the northern Iraq theater. And we treated casualties fresh off the battlefield. We stabilized them, performed damage control surgery. If they could be treated and returned to duty within 48 hours, we kept them there. Most of them obviously couldn't, and then we evacuated them after stabilization to the next level of care, either in Baghdad or in Germany or back in the United States. Then in 2011, I was chief of anesthesia again in a Army hospital in Tikrit, the 256th Combat Support Hospital Task Force. We were winding down our mission in Iraq at that time. So we were once again doing some trauma, but mostly taking care of our forces there, taking care of our contractors. And I also had the opportunity to work with Iraqi physicians, because we were at that point getting ready to turn that base back over to the Iraqi army. And I was able to work with Iraqi army physicians in sort of bringing them up to speed on some of our lessons learned in the battlefield there. Now, the second half of my career, right after that deployment, was basically devoted to coaching and training medical units in order to prepare them for combat deployment. This involved working with a medical training support brigade, and I worked as a coach and trainer for units that were getting ready to go overseas. And it was really rewarding for me to be able to take my combat experience and then design scenarios and coach them through those scenarios and give some realism to their combat training exercises in order to prepare them for the next level. So that was my experience. And Dr. Johnson, I know in your service, you have had the opportunity for leadership and military command and control. And I think it would be really interesting for you to share that with our viewers.
Thank you, Randy. In fact, yes. Whether it was for direct patient care or leadership, there are so many examples of the impact and importance of the work that we do in the military and how it impacts the community. In 2011, I began pursuing what's called graduate level military leadership courses, or ILE, or intermediate level education, really to refine my military and professional skills. Throughout this rigorous program, I engaged in advanced studies covering operational planning, joint force integration, and leadership theory. The curriculum really emphasized not only academic excellence, but also the practical application of leadership principles in complex military environments. By collaborating with my fellow officers from diverse backgrounds and other specialty branches, I broadened my perspective on strategic decision making and enhanced my ability to lead effectively in dynamic situations. This experience significantly contributed to my professional growth and prepared me for greater responsibilities within the military, for which the current role I serve as commander of the 7455th Medical Readiness Unit. This intensive academic environment also fosters critical thinking and adaptability, which proved invaluable when faced with real world challenges. This relationships I've built to this day, I continue to rely upon as I look to growing my career, providing a network of trust and peers and mentors for which I've had ongoing professional development. I can recall times when I've even supported humanitarian missions. One example is when I supported a unit going into Haiti in 2010 following the earthquake. I was a part of a US-led military team as part of New Horizons to provide humanitarian and civic assistance, including basic medical care, in a part of Haiti called Gonaives, where many Haitians had relocated after the disaster. The area faced water contamination, poor sanitation, and limited access to healthcare, leading to widespread illness. My team established temporary clinical sites despite challenging conditions and harsh weather and the demand that was into the thousands of people that needed care. But my leadership, both as a physician and as a commander, were invaluable to the exercise. The experience reinforced my commitment to medicine and the military. Throughout my
Yeah.
military, oh, go ahead, Randy. I'm sorry.
No, I was just curious if you had any other examples of missions that have really stuck with you over time.
Yeah, sure. Thank you. I was about to transition to that. Throughout my military career, I've traveled literally around the world in support of all of these missions, from Hawaii to Germany to the Philippines to Kuwait, Iraq, Guatemala, Kazakhstan, Cuba. The mission that struck me the most was the time I spent in Japan in 2009 supporting Orient Shield. It was a large scale training event between the US and the Japan Ground Self Defense Force designed to improve interoperability and staff coordination. I was serving as the only physician supporting the exercise and was responsible for the care of over 300 US soldiers within a confined space. The first evening of the exercise was a multicultural communal dining exercise. And following the event, we discovered an outbreak of influenza. Again, I became the doc responsible for ensuring the protection, safety, and welfare of everyone on the ground. And my main objective was keeping everyone safe, keeping everyone well, without jeopardizing our mission. I was asked by the commander, the operational commander, when should we be concerned? At the time, I was Major Johnson. When should we be concerned, Major Johnson? And I replied, when something happens to me and I'm no longer able to ensure the safety and welfare of others, since I'm the lead doc. As a result of repeat exposure, I also became ill with influenza, having treated all the infected soldiers. And I asked my soldiers, please don't call home and tell my wife that I'm ill because I don't want her to worry about me. However, much to my chagrin, my 68 Whiskeys, which are the U.S. Army combat medics, whom I had supervised and trained, were in fact in a position to now take care of me. And that's what the military is all about, taking care of each other. What struck me most during this time was that I had quickly assessed the situation, implemented isolation protocols, and coordinated with both the US and Japanese medical teams to contain the outbreak. The experience challenged my adaptability and my clinical decision-making skills, required constant vigilance and clear communication and coordination with the command team. But despite the pressure, I remained steadfast, prioritized the mission's objectives and the health of every personnel there. So, Dr. Rizor, let's turn to you.
Well, you probably heard the saying, the soldier lives in two worlds. And that's something that when you take up this commitment, you not only take on whatever responsibilities and whatever life is in the situation where you've gone, but at the same time, you're attached to what you left back home. Um, and people say, you know, that the transitions are hard. That transition from civilian life to military life to leaving your family. Um, and when you are overseas, one of the things you think about most is, you know, what's going on back home. You know, when I was in Iraq, um, I could hear 50 caliber gunfire from my bed, but I didn't I didn't have that sense of anxiety of things to go wrong because there were so many people there that could take care of me. I mean, I didn't have to worry about food. I didn't have to worry about laundry, transportation. I didn't worry about if the heat broke, if the water pipes broke, if the toilet got plugged up. If I got sick, I could just walk to the clinic, and there's somebody there to take care of me. But back home, my wife was in this house all by herself, and if any of those things occurred, there was no one to help her, and she was to take care of all that. So a lot of my time overseas is spent about thinking about you know what's going on back home, and really being thankful for the devotion that military spouses have. And it's if it's not for their strength, their service member spouse could not do the job that he or she is called up to do. Another thing that doctors worry about, you know, is what happens to my practice. You know, fortunately for me, I was in a group practice, and so I had partners that could take care of my patients. They could pay the overhead. They could keep the practice going, uh, keep all of our employees employed during the time that I was gone, and I didn't have to worry about that. People talk a lot about the difficulties of leaving and going overseas. To me, being deployed was pretty easy, and the hard part was coming home. When you're deployed, and I know you know this, you are surrounded by the best of the best. You're surrounded by some really true professionals who really know their job at all levels. And you see Americans, I like to say, you see Americans at their best in the worst of circumstances. When you come home, you see Americans at their worst in the best of circumstances. The first thing you do is you get off the plane and you look at the absolute beauty of our shining buildings and our clean air and our cars, our automobiles and our spectacular highways with no holes in them. Um, and then you begin to realize where you came from. You don't see any of that, and you realize the only reason that's there is because there's people there to take care of it. And you start to worry about, are Americans really up to the task of taking care of everything that we have? And it takes a while to work through that. That sense of almost like a fear of everything we have is so great. What if it all went away? The other thing that was hard about coming back is work wasn't the same. Um, you think you're irreplaceable, but when you come back, your patients and your staff have actually gotten used to working with other doctors, and it's almost like you have to reestablish yourself back in the life that you were so comfortable in just a few months before when you left it. So, what was it like for you?
Yeah, Randy, that's it's ironic that our paths and stories are so different. So it's great for the viewers to hear this. So unlike you, I was in solo practice, and so being an internist at the time, starting my own business when I was a younger physician and growing it to where it became. I put my heart and soul into my business, into my practice. But at the same time, I raised my hand and made a commitment to serve our country. And so I honored that commitment when it was time to deploy, whether through volunteerism or humanitarianism. And I was excited about serving, but a little nervous about what shape I would leave my practice in. Thankfully, I had a very supportive spouse. My wife learned the business side of running my practice, and so it was easy for us to find locum physicians to come in and fill in for me, thankfully, through what became the boots on the ground policy. So if we back up to the Desert Storm, the prior Gulf Wars era, when physicians were being mobilized for 12 to 15 months, when most of them came back, they came back to no longer having their practices or no longer having their patients. And so thankfully, when I mobilized, my very first mobilization, I was able to mobilize under the 90-day boots on the ground policy through the executive order issued by President George Bush, the first Bush. And soon after, Congress passed legislation that helped National Guard and reserve physicians serving overseas that even today benefit from the 90-day boots on the ground policy. But what scared me the most was what was going to happen to my business, my livelihood, and my ability to take care of my family when I come back. But thankfully, it all worked out. My wife did very well running the business side of the practice, and the physicians that were there temporarily did an excellent job taking care of my patients. Over the 20 years I ran my private practice, my patients got accustomed to my bedside manner and my altruism, and they were actually proud to say that my physicians overseas serve in his country when I would go to Kuwait or Iraq or other places. And so my patients were woven into the fabric of my military mission. And although we both had different paths, our work was the same. And it's just so amazing how it all worked out for both of us. But would you say what's kept you in for 22 years, Randy?
Well, it's hard to believe it's 22 years. First of all, it just flew by. When I originally joined, I thought that the war would last 2 or 3 years, and then I'd just be out. But uh, by the time my third combat deployment was completed, I'd already been in almost 10 years, and at that point, I was already halfway to a 20-year retirement. And at that point, retiring after 20 years is a little bit different from just separating from service. If you just separate before your full retirement, you're entitled to veterans benefits, but you don't keep your rank, and you don't enjoy full military retirement benefits, some of which can be very significant. Um, Probably the greatest of those is the healthcare benefit. And I think you need to realize this. As a doctor, it used to be you didn't have to worry about your health care because you just get it because of the fact you were a doctor. There's still a few doctors alive that remember that, but for
Hmm.
physicians nowadays, it's a very different story. And the military retiree health care benefit essentially covers all healthcare expenses for you and your spouse for the rest of your life, which doesn't mean much maybe to a 20-year-old, but it means a lot to a physician at the end of their career. So I decided I've been here this long. Let's stay on. And the second half of my career was just an absolute joy. Being able to take all of that experience that I had and then be able to use that to coach and mentor the next generation of Army healthcare professionals. Really, uh, it was just a rewarding conclusion to a career. And to think that at the beginning, I was thinking about how fast I could get out. And at the end, I'm thinking about how long can I stay in. I don't know that people realize this, but the mandatory retirement age for a Army physician is older, obviously, than an enlisted personnel. And as a doctor, you can stay in the Army until you're age 63. Now, if you have a specialty that is a critical wartime specialty, or if you are an essential person in the military chain of command, that can be extended at the discretion of the Secretary of the Army all the way to age 72. And I was fortunate enough to be able to stay all the way until age 72. So you, although you're not anywhere near my age, you've been in for almost 30 years. So what's motivated you to stay?
Yeah, my wife asks me that question all the time. We both made reference to our families. And I think for our children, our grandchildren, being able to say that we serve our country to protect our borders, protect our freedom, that's important to me. That sense of selfless service, duty, honor, providing a care to others is really important to me. When I hit the 20-year mark, I felt like, I'm not ready to get out. I think I can continue doing this. I loved the camaraderie, the sense of esprit de corps that you get from being in the military. It's just so rewarding. It really resonates with me both as a physician, as a military officer, that sense of selfless service. It's just been the core of who I am, placing the mission and your team before yourself. It just doesn't end with taking off your uniform. It becomes the foundation of how you lead your family, your community, and your career. That said, I joined MAA to advocate for my patients and other physicians. Over the years, I have enjoyed incredible opportunities made possible by the Medical Association of Atlanta to collaborate with physician leaders such as yourself, Randy, as well as legislators within our great state of Georgia and other key stakeholders who kindly share their wisdom and experience with me. The many lessons I've learned, aside from being in the military, have aided my private practice and have made me a better officer in uniform. These are all core competencies that I've leveraged in my role as Chief Medical Officer at G.E.H.A. For those in public service, supportive systems that understand selfless service is critical. I'm in a business that serves those who serve others. Organizations like G.E.H.A are part of that, offering tailored benefits for the federal employees and military families in times such as these. As a colonel in the U.S. Army Reserves, I see military doctors embracing the chance to work without revenue or patient quotas, free to provide care and compassion for everyday service members. When asked what motivates me to stay, the answer is simple: the people and the purpose. So here's my final question for you, Dr. Reiser. What would you say to anyone interested in pursuing a career in medicine, particularly military medicine, that's potentially thinking about joining?
I, I want to share a quote from Abigail Adams, who was the wife of one president, John Adams, and the mother of another president, John Quincy Adams. And this is from a letter that she wrote to her son, John Quincy Adams, when they were separated during wartime. And she said to him, "These are the times in which a genius would wish to live. It's not in the still calm life or the repose of a Pacific station that great characters are formed. The habits of a vigorous mind are formed in contending with difficulties. Great necessities call out great virtues. When a mind is raised and animated by scenes that engage the heart, then those qualities which would otherwise lay dormant wake into life and form the character of the hero and the statesman." So what I would say is think about the qualities that you want to develop. Think about what is laying dormant in you and challenge yourself to be the best you can be as a physician, as a person, and as an American.
Thank you, Randy. We'd like to thank our audience for tuning in, and thank you, Dr. Reiser, for taking time to speak about something important to both of us. On a personal note, I'd like to thank you for being a mentor to me as a physician and a military officer. Sir Isaac Newton once said, "If I have seen further than others, it's by standing on the shoulders of giants." And Randy, you have been one of those giants in my life, personally in my career, that have helped shape my presidency when I led MAA. To all of our veterans, it is an honor and a privilege to have served alongside of you, and we want to express our gratitude for your service. For those that have passed, and for those that have retired, and for those that are still serving, we say thank you.
Thank you.